All right, Amber, thanks so much for having me here at your amazing campus and also your private office. I really appreciate your time.
Yeah, absolutely.
So just give us a quick snapshot of who you are, your title, where we are today, and then we'll kind of go from there.
Yeah. Well, thank you for being here. Appreciate you reaching out and being here today. So, I am the area CEO for Encompass Health Rehabilitation Hospital of Henry County. We're right here off of Patrick Henry Parkway. I oversee this hospital here in Henry County, but I also oversee our hospital in Noonan, Georgia, and Coweta County as well.
Okay.
So a little bit about me. My background's accounting. I've been with the company now for about 13 years. Worked at our home office in Birmingham, Alabama for about 6 or 7 years there in accounting. And then I kind of spread my wings and went out to the field and started working in our hospital settings and just loved it. Love the people, love the patients, and really what we do. It's really a great place to work and be proud of where you work. So I was given the opportunity to become a CEO and take on the challenging aspect of all that is included in being a CEO. So I was brought here to McDonough, Georgia, a couple years ago to help open this hospital that we're sitting in today.
So obviously it's a transition between accounting and healthcare. How did you make that transition? That's interesting.
Yeah, so I actually, when I left the home office in Birmingham, I went up to Massachusetts and I became a controller for actually really a competitor of Encompass at the time. But a controller or CFO is a really vital important in the hospital setting. They oversee the financials of the hospital. They oversee the operations of the hospital as well in some aspects. And from there, I transitioned into the hospital operations. So, I was able to kind of use my financial background and decision making and my people skills for managing people and employees and working with our patients and their families. So it was kind of just a natural fit, I would say.
So we talked before we started recording just about the complexity of healthcare, the different challenges that families face. What's been your experience in just dialoguing with families and them trying to figure out the best options for their let's say aging loved ones or maybe just recently injured loved ones?
Yeah.
Navigating families through that, what's been your experience like?
Yeah, so it is definitely a challenge. First of all, it's a challenge just really understanding what the different levels of care are, what the patient is going to actually experience in the different levels of care. And then you couple that with just all the complexities of insurance and trying to navigate through Medicare versus Medicare Advantage and commercial products. It can become very overwhelming and very confusing for families who are put into this sudden situation that has occurred, and most of the times are not necessarily expecting something to happen,
Right.
to their loved one. And so it is a challenge determining what is the best place for mom or dad or sister or brother to go for a next level of care.
So that kind of leads into a good question. What is inpatient rehab, and what are, let's say, the differences to a family between inpatient rehab and, say, a skilled nursing facility or a longer-term care facility? Why would a family choose Encompass versus some of those other rehab options?
Yeah, so that's a great question. One that has a lot of misinformation around it, I would say.
Yeah.
So let me dissect and break the question down. So the first part of the question, what is an inpatient rehabilitation hospital? So our inpatient rehabilitation hospitals serve patients after they have maybe experienced a life-changing event, a traumatic event, such as a stroke, a hip fracture, brain injury, cardiac event. There's many diagnoses that we help. But a lot of times those patients have been in the hospital setting for a little while, and they need an extended place to go for additional recovery and rehabilitation. Our rehabilitation hospitals have a big focus on intensive therapy. We have physical therapy, occupational therapy, speech-language pathology. We also have an interdisciplinary approach to the patient's care. We individualize plans of care for our patients. We have physicians in our hospital that round on patients every day and see those patients. So the difference between our setting and, let's say, a long-term care facility or a skilled nursing facility there's quite a bit involved there. So one, we are actually required per our license and per CMS to provide 3 hours of therapy 5 days a week. So our patients, when they come in, they will receive a more intense level of therapy, which turns into faster healing, better outcomes, going home sooner, getting back out into the community and reentering the community. Also, our therapists focus in on more functional activities. So it's not just when you think about rehabilitation, some people have maybe some misinformation that you're going to be maybe running on a treadmill or riding a bike, Well, there might be a little bit of that, but mobility is really important for physical therapy. We really try to focus in on functional activities as well. So really trying to simulate being out in a parking lot, for example.
Yeah.
We have a courtyard that has a parking lot has asphalt down. So we want patients to understand and know, how do you use a walker on asphalt? How do you use a walker on a brick pathway? How do you step up on a curb? So really trying to simulate more functional activities. With occupational therapy, we also focus on things like dressing, grooming, bathing, some of those things that I think we just take for granted, when it comes to just getting ready in the morning, getting up out of bed, getting dressed. That's what our team really focuses on, is trying to get back to that function to a patient's life and helping them to reenter the community. I also mentioned the physician component. So our physicians do round here every day. We have physicians that specialize in rehabilitation. They're called physical medicine and rehab physicians. They're actually board certified in physical medicine and rehab. So they're used to working with therapists, working with plans of care individualized to meet the patient's needs, as well as just how a patient might perform in therapy and how they might progress in therapy.
Yeah.
We also have that hospital level of care that we offer. So we do provide a higher level of care in terms of the types of medications that we provide to patients, more oversight from a pharmacist that's part of our interdisciplinary care team. We have case management, social workers, dietitians, 24-hour nursing care. We always have RNs on staff and an RN supervisor. So there's a lot of extra things that we offer to our patients when they come here after maybe a hospital stay.
So what are the most common situations that might lead up to a stay? In home care, we talk a lot about risk factors and how we can prevent those things when we're in the home setting, providing, let's say, 8, 10, 12 hours a day of care for clients. But what are some of those things that tend to be the recurring events that lead to the hospital stay and then lead to, let's say, a patient coming here?
Yeah, there's really quite an array of situations that could occur. Our number one diagnoses that we treat is stroke and neuro. So we really do treat a lot of post-stroke patients. We actually partner with the American Heart Association on a national level because we have seen in independent studies that patients that following a stroke do better in an inpatient rehabilitation setting than they do in other settings. They make better progress, they have better outcomes. So stroke is definitely a big diagnosis that we treat here. We're actually working on our stroke certification with the Joint Commission right now. So we're hoping to have our stroke certification in the next year. But it could be a hip fracture. Patient has a fall at home. So they have to go see an orthopedist, maybe have surgery. So it could be a car accident. A patient ends up in a car accident and has a multi-traumatic event. They're in a lot of pain. They can't move some of their limbs. And our team can help them work through that pain and get back to doing some things that they used to do before, and maybe help them get back to the best version of themselves. It may look a little different than it did before, but our goal is to try to tailor the care to meet the needs of the patient coming in.
Okay. Yeah, I've taken a tour. Your staff's been super generous over the past few months that I've been meeting with them, and so they've taken me on a tour of the facility, and the gym is incredible. I mean, I know you talked a little bit about some of the activities of daily living that you all are encouraging them to work on, but just taking a walk around the gym, I mean, the car example, that getting in and out of a car, I mean, there's so much here that you guys can really use to facilitate the patient getting better, right? Yeah. And then practicing those daily things that they're going to encounter. One thing that I've heard kind of recurringly from families is their assumption that they don't have a choice in where they do rehabilitation after, let's say, a hospital stay. So talk to me about that. How would a family, let's say they just learned that the loved one fell, broke a hip, they're going to have a hospital visit upcoming, but they know that they'll be in a position where they're going to have some rehab once they discharge from the hospital. How would the family go about connecting with Encompass and then going on the journey from there?
Yeah, that's a great question. I do think there's a lot of misinformation around that as well. I will say that patients absolutely have a choice, that the hospitals that patients are in, those referral sources are actually required to provide patient choice prior to sending them somewhere, to that next level of care. So your case manager, your physician, they make recommendations of where they think the patient may be qualified to go, but that isn't always the case. There could be some variations there. So the patients and families, I would absolutely recommend that they do their research. Definitely going on to the hospital's website. For example, we have a tour on our hospital website. That is a great piece to look at and to go through and to see. You can also come here and tour to determine if this is the right setting for you. Meet some of the people, feel the culture. When you enter a building, you can have a good feel for if the people are nice or you feel like they're going to take good care of mom or dad. Also, most places, and we do specifically, have what we call liaisons that are out in the field.
Mm-hmm.
So any patient or family can also always ask to speak to a representative of a company or a hospital or a post-acute care placement that they're interested in going. So our liaisons will go out, they'll go to the bedside, they talk to the patients, they do an assessment, they talk with their case manager, they talk with any family members, get some history about what the patient's been doing, look at kind of currently what the patient's been doing, have they been working with therapy. So that liaison is really a great resource for helping in the decision-making process. They can answer any questions that the family member has, they can provide additional material, they can provide outcomes. There are several websites as well that the hospital should be providing, or data points, I should say, that the hospital should be providing to the patients and family about their choices. So, for example, there's an IRFcompare.gov website that you can go to actually compare our location and our quality outcomes to other like settings. There's also SNFcompare.gov for skilled nursing facilities where you can compare one setting to the other. So the big takeaway there is that patients really have a choice. So just because a case manager says, oh, we think you should go to a skilled nursing facility, that doesn't mean the patient or the family can't ask the case manager, well, would you mind sending a referral to an inpatient rehab hospital or to Encompass Health specifically? They should be able to do that for the patient and family, and really they have to.
Yeah, I would encourage any family that is in a discharge situation, if they know they have to have some rehab, to at a minimum contact you guys, even if the case manager is not being proactive in giving that referral.
Yeah.
Contact you all, and you can, I'm sure, help
Yes.
facilitate.
Absolutely. I'm glad you said that because they could call us directly.
Right.
They can absolutely call us directly. Just call our main line, and our receptionist will make sure they get to our admission liaison's office, is what we call that, and they will triage and make sure that the liaison out in the field actually goes to the patient's bedside, and the liaison will then let the case manager know, we got a call from your loved one. They wanted us to come in and see this patient, that kind of thing. So yeah, definitely, they can definitely do that.
Well, it's an incredible facility. I really appreciate you taking the time to tell our audience just a little bit more about inpatient rehab. This is really an amazing place to recover, and that's the goal for, I know, all of your staff as well.
Yeah, it absolutely is. And, I think that if anyone has an opportunity to ever come by and check us out, our doors are always open. And just meeting the staff and kind of seeing the gym, like you said, and some of the things that we offer in there, it really sets us apart from other post-acute care settings. You're not going to go into just a skilled nursing facility or kind of a rehab center and get the type of therapy that patients would receive here. And so we're really proud of that. We're really proud of the outcomes that we provide. Our team members are very passionate about what they do and caring for patients. And We're very outcome driven, and so patient outcomes and patient experience is extremely important to us as a company.
Well, we've shared many patients across our company and y'all, and we hear nothing but good things.
Oh,
So
good.
This has been really helpful. I think that this will really be beneficial for folks that are needing what you guys have to offer. So how can people get more information if they are still confused about how to contact you guys? What's the best way to reach out if they call here directly?
Yeah, so we have our website. It's encompasshealth.com/Henry Rehab that they can go to, or just Google us, Encompass Health Henry, and we'll come right up, and just call that main number, and we'd be happy to help anybody that has questions. Another point I just wanted to make on
Sure.
top of that is that even if you're not sure if this is the right place to you, our liaisons or our team members are always happy to have a conversation. So it doesn't mean that once you're seeking out information that you have to choose us. That option is always still there. But 9 times out of 10, if you come in and see the services that we offer, I think that this is a great place to come in for inpatient rehabilitation. So
I was wandering through the halls of Piedmont Henry after just talking with some social workers, and I ran right into Carla Baker.
Yeah.
And so you could tell she's making sure she's getting around and connecting with everybody that needs
Yeah.
what you guys have to offer.
Yeah,
So,
and Carla's one of our liaisons that
Yeah.
I was mentioning earlier, and they are so passionate too. Once they get involved in a patient's case, they are so passionate. They make sure that that family and that patient has everything that they need to make the right decision. And so they're a great resource. They really are. They do a great job.
awesome. Well, thank you again for the
Yeah,
invitation
thank
here to
you.
the campus, and thanks for taking the time, Amber.
Yeah, thank you, Harrison. I
All
appreciate
right,
it.
take care.
All right.